Hello, everyone, and welcome to the first edition of the Diabetes Care Summit. I'm Dr. Barbara Akimbua, and I'm your health buddy. This summit is for you if you've been diabetic for a while and you've been struggling with keeping your blood sugar controlled, either because you have problems knowing what to eat, when to eat, how to eat, what else you need to do to keep healthy, or you do know these things, but it's difficult to be motivated. It's also for you if you have an elderly parent who is diabetic that you care for and you find juggling medications, clinic visits, meals, and then illnesses in between overwhelming. Or you're a beautiful married woman and all you would love to have is a normal pregnancy and delivery. And instead, you keep having miscarriages and stillbirths as a result of complications of diabetes. Or it could be your husband. He is the one who's diabetic. And during sex, you have problems. It's either most of the time he can't get it up, or he has other problems while you're having action. It's also for you if you're a health enthusiast and you believe that prevention is cheaper and better than cure. And so you'd like to learn anything you need to know to stay healthy. During this summit, you listen to loads of interviews by different specialists, including myself. Some of the interviews are short and some are not so short. But I'd encourage you to watch each video till the end because there's loads of important health information and you're getting it all for free. So, once again, welcome to the Diabetes Care Summit. And don't forget, I'm Dr. Barbara Akimbua and I'm your health buddy. See you on the healthy side. Today, I have a special guest. I'm going to let her introduce herself. We are going to be discussing how we can plan to fund healthcare needs so that it's not that difficult when issues like that arise. So, Damilola, I'd like you to introduce yourself. Tell us who you are and what you do.
Thank you, Dr. Barbara Kimbua, for having me this afternoon. My name is Damilola Hassan. I'm a financial planner. So primarily what I've done over the years is to handhold people, individuals, families, and of course, corporate institutions on how to manage their finances. I provide investment advisory, the entire gamut of wealth management. Wealth management really just spans across, growing what you have in terms of your finances, preserving, what you have. So it's not just about growing, preserving it. How do you hedge against inflation? How do you, protect the value of what you have as it grows? And then ultimately transferring wealth. So you've grown your wealth, but then you won't be here forever. So how are you putting your assets in order such that you can transfer? So that's basically what I do: wealth management, growth, preservation, and transfer of wealth. It will be a pleasure speaking, sharing ideas with you this afternoon. Of course, I'm not a healthcare professional, so I leave that bit to you. I'm just going to bring in the money bit to this conversation. Thank you for having me.
You're welcome. I'm glad to have you. And yes, we're not talking about the health. We're talking about funding the health bit, which is where you come in because without funding, it can be a calamity. It's painful
Mhm.
to watch a loved one go through ill health and you don't have the funds to take care of them. So what does funding mean?
Yeah, so primarily it is just the concept of setting aside um, money money is a universal instrument, to exchange for value, So funding would just mean setting something aside. You are providing money to cater to a specific need.
Okay, so if you have a personal health fund, it means you set money aside to take care of your health needs.
I didn't hear that. Sorry.
I
Can you say
said
that again?
what I gather from what you said is, if since funding is setting money aside to cater for a need, the health fund is setting money aside to cater for a health need. Many, right?
Exactly.
Okay, good.
Exactly.
Good. So what are different sources of funding? What are different sources of funds that we can use for health?
Okay, so different sources of funding for healthcare. We are in a part of the world where the primary responsibility for our healthcare, just as it is with a lot of things, is left to us. I mean, to you and I. We have to cater for ourselves. There's a limit to what is available to individuals, by the government. I mean, just by me looking even at the budget of federal government, what percentage has been allocated to healthcare? I mean, below 6% on the average over the years. So really, there's no special provision for you and I when it comes to our healthcare, whether for today or tomorrow or the years to come. So it leaves the responsibility to you. So off the top of my head, we are all aware of insurance, the health insurance option that allows you to, like the way insurance works, fund an insurance package by paying a premium, and that gives you access to an array of health care services. So depending on the extent to which the premium you pay, and the package that you go for, that then determines what sort of healthcare facilities you can have access to. So that's the general one. But how many people are enrolled on this? I mean, so you know what the numbers are. So the other alternative is to take care of your healthcare needs as they come. So I'm talking about, that's the pattern as they come. So you have a need today, you dip hands in your pocket and you care for it. Tomorrow you have another need, you put your hands in your pocket, and then you take care of it. So we really don't have any robust structure or anything that is long term, that is sustainable. So that puts us in a very challenging situation here in Nigeria.
Okay, so the two main sources of funding in Nigeria and in Africa in general is out of your pocket, or if you have health insurance.
Yeah.
So you can, but then with health insurance, just like with your pocket, it's not endless. It doesn't mean whatever happens, it will cover everything. So depending,
Absolutely.
yes, so depending on what package you have with your health insurance, that determines what they will care for, what will they will pay for you.
Mm-hmm.
So
Yeah.
because of these limitations in Africa, what other avenues do we see people, like we see people when they are ill and they need funds, let's say for cancer treatment or for a heart transplant or a kidney transplant. If it's not covered by health insurance, or they don't have health insurance, or they can't even pay for it, then what other options do they go to?
So let me start by saying that I think that if the very first thing we all should, and I also come back to your question, the very first thing we all should try to achieve is even to take care of ourselves, the prevention. So I think being intentional about funding your healthy lifestyle is part of the funding that you want to be conscious of. You know, a lot of times we think that
We should wait
maintaining your
until
health,
something happens, then we
yes,
wait. But you are
yes,
saying we should focus on funding preventive health so that
exactly.
we don't even get to the point where we need to pay for those very expensive interventions.
Yes, absolutely. And so we need to even see that as something that we should make provision for.
Okay.
Of
So we should,
course, go ahead.
yeah, we should actively invest in preventive healthcare on a regular basis.
Yes.
Okay. So
And then that's the prevention. But then we all know that we can't control this thing.
what
So you
happens?
can, yeah, you can't, you are not absolutely in control. But there are certain things that to a large extent you can knock off if you keep the right lifestyle. So the other leg will now then be in a situation where you now have a healthcare challenge. How do you fund it? You don't begin to fund it on the day you fall sick. It's just like retirement. So for us, as financial planners, we encourage people to have an open mind. The same way you are planning maybe life after retirement, you are thinking, it's going to require certain things to put you for you to put certain things in place before you get to that point when you retire. You don't plan for retirement when you are retiring. You know, it's the same thing. So your overall, so if you're at the stage where you're planning for retirement, I would say plan for your healthcare, funding your healthcare and retirement alongside what the rest of the planning that you're doing. You know, so it starts by keeping an open mind to the fact that I don't pray it happens, but anything can happen. So, do I have an emergency fund? Do I have a go to fund? Do I have a retirement fund, that can accommodate certain emergencies? So it starts from preparing, as of today when you're very healthy.
Hi, have you heard of Soyo, the new diabetes care app? Studies show that the best medicine to take for diabetes is to get education about it. Because if you understand how it affects your body, you'll know better what you need to do to fight it. It will also help you to take care of someone else with diabetes. With the app, you don't just get education, you also get to make your management plan either for yourself or the person you're taking care of. There are also lots of other features like meal plans, medication, and other reminders to keep you on track. And if you fall off, don't worry, just get back on. This is how families can live healthy and happy with diabetes. Don't be left behind. Download the app at soyo.web.app to care for yourself or someone else with diabetes. I like that. So it means we have to be proactive. We don't wait. It's good to pray. We all pray. But then we need to be prepared as well. Even the Bible says we should be prepared because we do not know the. So you don't know if it will happen. You don't know when it will happen. So you
Yeah.
should be prepared and you should start actively saving for a health emergency just in case it happens.
Mm-hmm. Mm-hmm.
So
Yes.
working in the hospital, what we see is when patients have that kind of problem, they start looking for money to borrow.
Mm.
If they have property, some of them will decide to sell off. Another thing, people with social media, some people have started,
Crowdfund.
yes, crowdfunding, GoFundMe, and with the advent of social media as well, and there are these radio and TV stations that organize programs where they talk about these issues and publicize them and then give people accounts for paying. But those methods are not effective in an emergency. because in an emergency you need it. Yes, you need the money. You need to pay for the service immediately. So it's a difficult one. It's a difficult situation to be in because you are at the mercy of you can't tell what's going to happen. You can't tell if people will respond. You can't tell if you even get enough funds.
Mm.
So in Nigeria, a lot of people feel government should pay for their health care. So even with health insurance for enrollees, we call them enrollees that are on health insurance. Not everything is covered on that package, but people feel that they're on insurance, so insurance should cover everything. Or it's a government hospital, so everything should be available. Is it
Mm.
feasible for government to pay for healthcare for everybody in Nigeria?
Okay, Barbara, let me ask you. Is it feasible, is it feasible for government to subsidize petroleum for everybody in Nigeria?
Well, I'm a medical doctor. You are the financial expert.
So I think that it's a matter of priority.
Okay.
It's a matter of priority. So as it is in Nigeria, we are spending huge amounts of money to subsidize petrol, PMS, both for those who can afford it and those who can't. Yeah, so if there are several people who can afford to buy PMS at whatever price without the subsidy. But now there's an umbrella subsidy, that covers the rich and the poor. Okay, do we need to spend that kind of money? Well, I'm not an economist, so, but just commonsensically analyzing it, if we have our priorities in place, if healthcare is a priority, we will focus and we will make it happen. I mean, African leaders came together in when they had this UN program. I think that was in 2001. And I think the meeting held in Abuja when they made this popular Abuja declaration that going forward, African countries were committing to 15% of our budget will go into healthcare. That's 2001. I am not sure Nigeria has ever met that. I'm not sure. I very much doubt it. 15%. So just imagine what 15% can do. So just imagine sitting down and allocating 15% from the very bottom of the ladder. So I'm not talking about subsidizing healthcare for everybody because, again, some people can and some can. What you don't want is you don't want that next person dying on the hospital bed or dying on the street, dying in their homes because they cannot have access to simple healthcare. And sometimes some of their situations are not as complex. Some people still die from malaria. People still die from cholera in this country. What does it cost to cure malaria? What does it cost to treat malaria? Look at those numbers and look at the number of people dying. So if we really prioritize, I believe that as a nation, we can do it. But if we're only paying lip service to healthcare and we are not putting, the resources to back up whatever it is that we are claiming, then we've only just left people to themselves. So we are back to the issue of everybody taking care of themselves, which is sad.
Wow. So how since the onus falls back on us because there is a role for government to play, obviously, and there's a role that we also have to play. Government can't do everything. How can we plan to fund our healthcare? How does a family or a person set about planning for healthcare plan?
Okay. We spoke earlier about the preventive bit. I don't want to sound like a broken record, but our orientation needs to change. We need to know that starting from the quality of what you eat, and I'm not saying quantity, I'm talking about quality. I'm talking about the choices we make. The choice between should I fry this meat or should I just boil and eat it? Those simple choices, our funding begins from there. How are we funding our lifestyle such that we can maintain the best of health? What are the things within our control? So, and I'm not speaking to somebody may be listening to me and thinking, okay, she's saying that because she is, some people can afford this and that. I'm saying at whatever level you are. So you are living in an area, an overpopulated area where you have your drainages are blocked, and so you have mosquitoes and you have all of that infesting that your area. Funding your healthcare would mean you getting up on a Saturday with your neighbors to clear your drainage, to free the drainage, to make your habitation less prone, to mosquitoes, such that you can prevent malaria for yourself, for your children. Don't, rather than keeping aside money for malaria medicines, buying a mosquito net, and so that's one bit to it. Then, like we tell people, when you're planning your finances, build an emergency fund. There are several platforms that you can use that help you to automate your savings, that help you to take something aside and keep for the rainy day. So when we're talking about the rainy day, it can be anything. It can be a health challenge. So that's discipline of setting aside consistently an emergency fund. And the rule of thumb is that you should have an average of 5% of what you earn going into your emergency fund that you're not touching, because it is an emergency fund. And over time, as you build it, there are opportunities for you to now then invest. Maybe they become something significant. You can then invest such that it is still emergency, but you are setting it aside consciously. And God forbid, when that need, if the need arises for you to deploy that to your health, then you would have it available. Another thing is, it's important to, for people, for us to learn and see how best we can do things. Learn from people who are professionals. What are people advising? So if you have what you call an emergency fund now, and then you are think, or you have, let me not just use emergency fund. You have some amount of money that you've set aside for the future, for just for the rainy day. You need to understand what we describe as asset allocation. What are you allocating? What kind of investment are you allocating those funds to? You should ensure that a certain portion of your savings or your investment are in what we call liquid investments that you can easily flip to raise the money that you require. You imagine if you've spent the last 2 years saving, and you put all of your savings, you go put in to
A
buy
house.
a land, buy a house, and then you don't have anything at all, but you are very happy that you've bought a house. If an emergency breaks, what will you do? You can't sell the roof of your house, you can't sell first floor, you can't sell wing one room, so that's why you now then find people having to sell precious assets for next to nothing, because they need to. Imagine someone selling a 25 million naira house because they have a 1 million naira healthcare need. So it's important to also learn how to allocate your funds that you set aside. Am I putting it in not something that you can easily retrieve and keep spending, but it should be in a manner that you can at least be able to turn it into cash without so much hassles when there's that need to.
So I really like what you said. And what I take away from this is that funding doesn't only involve money, it involves actions that you take. Like the example you gave with your gutter is overflowing with stagnant water and it can breed mosquitoes. and you can get malaria from the mosquito. So cleaning that gutter is part of funding your health care. Eating healthy meals and not necessarily expensive meals is part of funding your health. And then it is not quantity that makes it healthy, it is the quality. So funding, the actual funds you need to exchange is just a part of what funding is. The final thing you said is discipline. You must set aside a portion of what you make periodically, whether it is every week or every month. You set it and you forget that it is there. You don't go to take it when you want to get something else because it is allocated, it is specifically for a
Yeah.
health challenge. So it's
Mm-hmm.
not when you want to buy another tire or something else happens. It is for health. So you keep building that fund for that rainy day or rainy health day when it is.
Hmm.
Then finally, it must be in a form that you can easily retrieve, like if it's an emergency. Those are
Yeah.
nuggets of gold. So, what is a financial plan?
It summarizes everything we've been talking about. Sitting down, putting pen to paper to plan your finances. What do I earn now? What are my needs? On separating your needs from your wants. How do I maintain my lifestyle? How do I, preserve what I have? How do I consciously and consistently set aside what targets do I have financially? So I'm 25, by age 35, what are my financial goals? So a plan is, you have a dream, you have a picture of what you want your finances to look like, XYZ from now. 10 years from now, 20 years from now, you have an idea of what you want it to look like. So you now then put a plan in place to actualize it. So a financial plan is like the bridge that connects your financial goals to your current reality. So how are you moving from where you are now financially to where you dream to become financially? What plan have you put in place? And so your plan must be actionable. Your plan must be realistic. Your plan must be easy to follow through, and you must be accountable, for whatever you have put down as a plan.
Great. So, a financial plan is itemizing how you need to spend your money from now till whenever it is based on where you want to get to, from where you are, so that you can get from where you are now to where you want to get.
You
And you
want to
must
be.
plan it. Good.
Yeah.
Excellent. So when is the best time to start creating a financial plan?
Okay. I always reference a Chinese proverb whenever I'm speaking of financial planning, and it says that the best time to plant a bamboo tree was 20 years ago. I mean, because if you did 20 years ago, you would have a bamboo tree now. But the second best time is now. So when is the best time? Start now if you haven't started. If you have and you haven't been consistent, go back to being consistent. If you are part of the people that say things like, what I have is not even enough to take care of my today, and you are asking me, I hear that a lot, and you're asking me to set aside for tomorrow. I understand. And when I say I understand, I truly do. I know how challenging it can be, to live within a certain amount of money. I mean, looking at inflation and everything. So while I'm not going to be unrealistic by saying, yes, no matter what it is, you must still save from that when what you are earning is barely enough, I would challenge you, explore how you can expand your income base. What else can bring money? So, I like to talk about growing wealth, preserving and transferring. How are you even growing what you have? Um, what skills do you have now? What skills can you add that can help you to earn more. So if you're at the point where you think you are not earning enough to even set aside, I will still say try to still set aside no matter how little, but then challenge yourself to expand on what you're earning. Ask yourself, what else can I do? How much free time do I have? What can I convert into cash? Some of us love to sit and scroll through Twitter and Instagram, and before you know it, 4 hours have gone. Doing what? What can you deploy that time to do that can fetch you additional income? Because nobody is going to help your situation. You have to help yourself. If you say, I don't have enough to save for tomorrow, yes, I understand. But what are you doing to change that? Otherwise, tomorrow will come and you'll still be saying, I still don't have enough for another tomorrow. So, do you want to live your life like that? There are things you can do. There are people who have products that you can sell on their behalf and you can earn a commission. You don't even need capital. There are so many things that you can do, but if you sit with a hopeless mindset or with the hopelessness of I don't have it, what can I do? It would limit you. You will end up just pitying yourself and you won't get anything done. So I charge you, go back to exploring what you can do to increase that income base. And perhaps you are not at that level, you're already at a level where you are earning well, but you just seem to be spending everything you are earning. You need to go back to developing a budget for yourself. How much are you spending? What are you spending on? Separate what you need from what you want. There are certain things that are just wants. Eliminate wants as much as possible. Delay gratification, So, are you conscious of all of those things? That is how to further improve on your ability to set aside, your ability to save for the rainy day. You can't, if like the saying, my where I come from, putting all your 10 fingers into your bowl of meal to eat, you won't have anything left for tomorrow. So we have to bear that in mind. What are those frivolous things that we are spending? Am I saying you shouldn't live a good life? No. But I'm saying that you are primarily responsible for the future that you desire. So you have to play your part to make it come to reality.
Thanks for that. What you've said, just what it reminds me of what you said about discipline. Because it's one thing to make a plan, it's another thing to stick to the plan.
Yeah.
And it can be difficult to delay gratification based on so
Oh.
many so many reasons. But the truth is that you can't get something for nothing. There's always a price to be paid. So even if you say your salary is small or is not enough, there are still things that you're spending money on. And if you really want to save, it's okay. This thing that I was spending 500 naira on, I'm going to be spending 300 naira and saving 200. It doesn't mean you should start from saving 50,000 or 100 or 500,000. You can start small. You can say, okay, I'll challenge myself. I'll save 500 naira every week and do
True.
that. And once you've done that, you say, okay, I've done this for a month. Let me try 1,000. And you take it from there. So it's little steps. It's building the discipline. I think that is more that that is also a difficulty.
Yeah.
So what are the things to consider when creating a health plan, a financial health plan? What are the things I want to create a health plan? What are the things? And then, for instance, maybe I earn 100,000 naira. What are the things I should consider? How do I, step by step, what should I do?
Okay. Okay. So there's no science to it, but I think what's important is start from asking yourself questions and be objective. Where am I? So, what is my current state of health? So, we're narrowing this down now to creating a financial plan for your health.
Yes.
So what is so when was the last time you did a medical checkup? To even know what exactly you are confronted with, what is your health situation like, then it's important to also check your family history, like you doctors always advise. Check your family history. So some have certain things that are genetically inherited and all of that. Check, so that just gives you an idea of the battle or ahead of you, the likely battle ahead of you. It's not given that it will happen, but it just gives you an idea of how, the more the battle is, the more the weapons that you want to gather, to help you fight it. So I think in asking those questions, you now then begin to ask yourself, what do I have? So in terms of what am I earning, what are my benefits? You won't believe that some people work in certain organizations where they have health insurance as part of their package. you know do you put a value to that? So for some people, you are not the one paying for that health insurance, your organization is paying for it. You should confirm from your HR, how much is this health insurance that you are paying for me, how much is it worth? You should have an idea of what they are paying on your behalf. If you can personally set that aside, because if you were paying it for yourself, you would pay it. So set it aside. So that forms part of the seed capital, funding that you are talking about. Put it aside. Some of us, little decisions. So if someone is trying to change a job because the next job is offering you 50,000 naira on top of what you're earning, whereas your health insurance covers uh, maybe like up to 1.5 million healthcare expenses, and the new place that is paying you 50,000 is not offering you any of that. You need to be conscious of your health. You need to prioritize your health. Place a premium on it. Otherwise, you will discount it. You won't factor it when you are making critical life decisions. So if you're going to take that new job that doesn't have the health insurance, because yes, you pray and you anoint yourself, so you believe you can't be sick, can you just set aside that premium, that extra that you are being paid? Can you set it aside and say, okay, this is an healthcare insurance fund? If you even want to feel good about it, you can tell yourself that at the point of me passing on, I'm going to add this money to my will, and my children can inherit it, and it can be a seed for their own healthcare. Or you can even say, I want to donate this to charity. So don't use religion to say, no, I can never be sick. Why should I have a health plan? Have it, because you can actually be a blessing to someone else who doesn't have. So there are so many things that we need to be very intentional about. So the question is, how do you put a financial health plan together for yourself? So I've talked about all of those things. Ask those questions so that you have an idea of what you need to even set aside. If you're benefiting from a health insurance, make the most of it. Do your medical checkups, whatever is allowable under your medical insurance. Take advantage of it, but set aside some money as if you are not personally paying for it. Then there are several platforms that you can, do your automated savings on. The way you are planning for your retirement, for example, and for retirement, we have our retirement savings account, and there's a policy already that says XYZ should be deducted monthly, blah, blah, blah. But we all know that hardly will what is in that retirement savings account, hardly will it sustain you through retirement or help you to actually live that desired lifestyle. So you are also consciously building a retirement plan outside of that. The same thing too that you can do for your health. Set it aside such that there's a consistency, to it. And there are several things that you can invest money in. Money market funds that will give you some, healthy returns over the years, and it just helps you to cushion. So you may not be able to actually set aside everything you will need because you don't even have an idea of what you will need. But you have a good base. You have something good enough to help as a cushion so that you are not left to, the messes of passerbys and family members if that critical moment comes. Yeah, thank you.
So what you're saying is we should have started 20 years ago, going 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 by the Chinese proverb, because a lot of the health challenges happen after retirement. When you're active and you're working, you are generally healthier than after you retire. So it's while you're working and you're earning that you're building that health fund.
Yeah.
So you are building it and saving for the rainy day when you retire, and probably you no longer have access to the health insurance provided by your employer. But because we also said at the beginning that health insurance doesn't cover everything, you also set aside a little extra just in case. It's you can't say for sure that this is the exact amount that you will need, and then there could be an emergency, so
Yeah.
that you have an emergency health fund for emergency, like somebody just has an accident and
Mm.
needs to have surgery on the leg to set the bones or something, or the person has appendicitis and needs to have an appendectomy. So those are not things that you see coming. So your what you set aside depends on, are you healthy now or not? Because
Mm.
still in Africa, we are seeing a lot of young people who are active and in the workforce who have illnesses, chronic illnesses, diabetes, hypertension. And for people like that, you already need health funds now while you're actively working. And you would need more when you retire
All right.
than the person that doesn't have any of these challenges.
Yeah.
So the English, I don't know if it's make hay while the sun is shining.
Mm-hmm.
We need to start now. And
No.
so, when are you retiring? That's one thing to consider. Are you healthy now? And then, do you have any ailment? Um, so this question: if I don't have a bank account, can I can I save? How can I save for health?
Can I ask a question? Why don't you have a bank account?
Well, not everybody works in the formal sector.
Yeah.
Yes, the trader that sells tomatoes in the market probably doesn't have a bank account.
Okay. So there's a lot of effort, and I understand. Prior to now, a lot of people had very wild ideas about how the banking system works, about how money in your account is not really yours, is taken away from you, but I think there's been a lot of and education, a lot of enlightenment over the years, even in marketplaces, in typically unbanked areas. You now have activities, that help people to, to be that are helping people to be drafted, into the financially included community. So it's we're so far off from the target, of the people in terms of the numbers of the unbanked. But I think that we all can do better, in helping to provide education as to the benefits of a simple bank account. A number of banks have also have um, payment. What you call it? This is agents. They have agency arrangements where the banking transactions have been brought, closer, to communities that don't even have an idea what a bank looks like. So a lot of those activities are going on. I mean, so you have people who can walk up to POS agents, they can do transfers, they can. So I believe that it's getting better. Not having a bank account still limits you, but at least to some extent you can execute financial transactions leveraging on those agency, and with the new license that CBN is granting to telecom, companies. It's still going to, so it's almost going to be akin to when the moment you have a telephone, you should be able to do some more financial transactions. And so it's getting better. So we just have to believe that it will keep getting better. And it would, the more people we have that are covered, within this space, the better it is for people to do transactions, the better it is for people to move money. So back to your question, there will be certain limitations without a bank account. So I would rather say that let's encourage people to, as much as possible, have one. You can have an inexpensive bank account. Now you have mobile banks, that you can have simple, basic bank account on your mobile phone, and I think it would only just get better.
Okay, so just still on this issue, can people use the local saving methods that they have been using? Like in the markets, they have these, I don't know whether it's Esusu they call them or
Through Ajo.
yeah. So are those ways of setting money aside while if you don't have a bank account or while you're trying to get one, or if that's what you're used to? Because
Many of the people that even do these things, they have bank accounts. They have some form of bank account or the other. I was still in Osho the market some days ago, to actually meet with a client. It was my first time going to meet, and limited education, but herself and so many other people around her have bank accounts. When you take enter their shops, you will see you can do transfer. For some of them, they say, no, I don't take transfer. As you're trying to if you don't have cash, there are POS agents all over the market, and they're calling the person. You are paying as little as 100 naira on top of every 10,000 transaction. It was really beautiful to see, looking at how they've worked around all of those things. So you have POS agents who are helping them, giving them cash, and then someone is picking it and depositing in the bank, and all of that. So life is easier with all of those options. Back to the issue of setting aside, through those informal means of Ajo and Esusu, that's what we've known from way back. But it does not have, it comes with its own risk. I've seen situations where that particular person that you're keeping money with, is robbed and the money is stolen, or the person just jackpot with your money. You've had situations where people are making contributions to somebody, and then the next thing the person has taken off to Canada and their money is gone. So there are platforms. There are platforms that are in place that provide the same service of you being able to set aside. What it just does is that it doesn't put you at the mercy of your fellow colleague or your fellow market person that you're saving money together. It just, and of course, when I say there are platforms, you now then need to be mindful, you need to check, are they regulated? The Securities and Exchange Commission regulates the investment space. So you need to be conscious of who is regulating them. So in selecting a platform to use for your automated savings and all of that, you should also be careful about what you're being promised. So some are being promised ridiculous returns on a monthly basis. And I tell people, if it is too good to be true,
probably
then
not true.
but do people listen? And then you hear cases of people losing billions aggregate to all sorts of schemes, because they were looking out for returns that are not realistic. So I understand there's a lot you want to do. You want your finances to grow. I don't know, you didn't start 20 years ago, so you want to play catch up. But you shouldn't also expose yourself to the risk of losing of your hard-earned cash because you are looking for returns that are out of the ordinary. So be careful, but rather than continue with informal arrangements of gathering money, okay, this person is the one taking the contribution today, next month it is that person, that has its own element of risk, so it's better when you find a more structured platform that can help you to do that.
Okay, we've learned a lot. I would like to ask just one more question. If you had one more piece of advice to give anybody that is thinking about planning for their health fund, what would it be?
Okay, so I have an advice for three categories of people. So I'm speaking to the young people, people who are below 30, who are in their early working career. I would like to let them know that your health is important. Prioritize your health. There are certain lifestyles that people have adopted at this very young age, and it's because they think I'm young, I still have a long way ahead, and all of that. Your body is your temple. Guard your body, take care of your body, mind what you consume. So treat it with respect. The body that would be with you for another 80 years, you should know how to take care of it now that you're 20, now that you're 25. So that's an important advice for that. For the middle age, between 30 and 50, be very conscious of your decisions, your money decisions. Set aside emergency funds. Be mindful of the sort of investment that you put funds in. Speak to professionals. Plan your lifestyle, plan your finances, plan your retirement. Don't leave it to chance, and be very intentional about the outcomes that you want for yourself. For the elderly people, people above 50, I would say that the retirement is upon you, or you're already retired. You're retired, but you're not necessarily tired. So stay active, keep your mind engaged, find ways that you can continue to be productive. I would also like to encourage people in that age category, to have what I would call a power of attorney. A power of attorney, just gives someone powers to take decisions on your behalf. A medical power of attorney specifically, so in a situation where you suddenly become incapacitated, or you are in a serious situation and you have dependents, but you're unable to carry out certain things, you want someone that you issued a power of attorney to be able to act on your behalf. So you can speak more to professional on all of these things. I'm available to provide further guidance as you require, but it's important that we all prioritize our health, we take care of ourselves, and we look forward to, so it's not just enough to look forward to a bright future, but we prepare our bodies to follow us into that bright future. Thank you.
Thank you so much, Damilola. I'm sure we've all learned a lot. The best time to start planning our health fund is 20 years ago, and the next best time is now. So everybody that needs to catch up should catch up. And don't forget, you need to have an emergency fund, and then you need to have a health fund, depending on whether you're healthy now or you're not. That determines how much you need to set aside. And then a good starting point is what you are paying now or what is being paid for you if you have health insurance. So Thank you for joining us and see you next time. I'm glad you took my advice and watched the video till the end, and I hope you learned a thing or two. So don't forget, watch the next videos because there's still lots of information that will be really beneficial to you. Don't forget soyo.web.app. Download it now. See you in the next video. Bye.